Hi, Dr. Muscarella. I'd like to talk to you about the management of benign gallbladder disease. Probably one of the most common problems we see in general surgery and gastrointestinal surgery practice. 15% of the population actually will have gallstones. The majority of them, though, are asymptomatic. And if the patients don't have any symptoms, we generally do not recommend intervention, surgery, or even follow-up imaging or surveillance. But of those 15% of people who have gallstones, 15% will have symptoms. The reason that people form gallstones is because the bile that's stored in your gallbladder has too high of a concentration of cholesterol in it, and that cholesterol will actually precipitate itself out into small particles and eventually stones. The gallbladder, it's an organ that sits under your liver. It's connected to the bile ducts. The bile ducts, they transport bile that's made in your liver down into your intestine, and the bile helps with digestion of food, especially fatty foods. So during normal digestion, what will happen is the liver creates the bile, it gets stored in your gallbladder, and then, like, let's say you eat some food or some food that has fat in it. That'll go down through your stomach and into your intestine. And your intestine, when it sees that there's fatty food in it, it sends a signal to the gallbladder, and the gallbladder will contract and empty the bile down into the intestine. Then it mixes with the food and it helps to digest it. So now, if you have stones that have formed in your gallbladder, they may just sit there and never cause a problem. But sometimes, maybe one of those stones could go into the opening of the gallbladder, and then when you eat food, it goes down in your intestine, the signal gets sent up to the gallbladder, and the gallbladder wants to contract to empty the bile, but it can't because there's a stone there blocking the way. And when that happens, the gallbladder stays distended, and there's little nerve fibers in the gallbladder that fire off, and it causes pain. That pain is usually located under the ribs on the right side, occurs a lot of times at night. It often is precipitated by the ingestion of a fatty meal or something like that. And it usually is self-limiting, lasting for, let's say, anywhere between 4 and 12 hours. Often it just resolves. All of these different symptoms might be reasons to consider removing the gallbladder. Again, as I said, it is probably the most common surgery that we do, that general surgeons perform and gastrointestinal surgeons perform. It's a very safe operation, and it's usually done minimally invasive, either laparoscopically or sometimes nowadays it's done robotically. A couple of things that I wanted to talk about specifically with gallbladder disease is gallbladder polyps. This is an area where I've done some research. Gallbladder polyps are basically polyps that can grow in your gallbladder and usually do not cause symptoms, but they're being increasingly recognized due to the widespread use of abdominal imaging. So nowadays, when you go see a doctor, if you have any kind of complaints at all, a lot of times they're going to be ordering an ultrasound or a CAT scan or something like that. And so it's not uncommon for us to see these things, these gallbladder polyps, on the imaging studies. And so very often, if a polyp is identified, the patient will be sent to either a gastroenterologist or sometimes a surgeon who performs gallbladder surgery to make a determination about what should be done. Now, a lot of different factors that we look at to determine whether or not the person should have surgery, such as the size of the polyp, whether or not they have suspicious features on imaging, as well as whether or not the patient has symptoms. These are all things that we take into account when we counsel the patient about whether or not to have surgery. What I will say is this, In a gallbladder polyp, if you remove the gallbladder and there's no cancer within the polyp, it's a 100% cure. And the risk of the surgery to remove the gallbladder, again, is very low, really less than 1% chance of complications. So all of these need to be really evaluated on an individual basis, looking at a number of different factors, but generally speaking, we tend to want to really remove these by performing a removal of the gallbladder so that we don't have to worry about the development of a dangerous cancer down the road.